Welcome to the Skilled Nursing Facility, SNF, Consolidated Billing, CB, your questions answered webinar. We're here to answer any questions you have regarding Skilled Nursing Facility Consolidated Billing. I am Tom Ryan with Provider Outreach and Education, and I'll be your presenter today. Today I'm joined by Ashley from my team. She's going to monitor that chat. She's going to ask me questions. She's going to give me a variety of different pieces of information. So if you have a question, feel free to put it in the chat. Remember that at the end of this slide deck, there is a disclaimer. The disclaimer is designed to help you and as a reminder that we are providing education and education only. The rules, laws, and regulations are on the CMS website, but we're going to go there as well. So don't think you're not going to get the opportunity to see that. So what I'm going to focus on today is to answer whatever questions you sent in during the registration process and then anything in the chat. But I do want to show you a few FAQs. And the reason that we're going to show those to you are hopefully that you'll find those questions useful and maybe in the future it'll be able to help you. But I don't want you to forget that we're going to go through just a little bit of basics. And the reason that I'm doing that is because we did have a couple of questions that are related to some of the basics. So I thought build some slides in, get that out there for you so you really get some basic level information. Hopefully we answer those questions and then we'll move on into registration questions and chat questions. Now the registration questions are in addition to the basic questions, and I'll try to highlight each one as we go. But again, use that chat feature for me if you do have a question. All right, so let's just get back to the high level basics. This was designed to get to everybody and to really answer a few of the questions we received, but we also want to make sure that we're hitting those people that did mention they were new to Medicare or relatively new to Medicare. First, thanks. And I want you to understand that SNF consolidated billing is a complex topic. Well, this is a question and answer session. I may not get into the detail that you need, or I might get into too much detail. So let me know. Also, there will be acronyms used throughout. If you don't know what an acronym is, put it in the chat and we'll get that answered for you. So we've already used two acronyms, SNF, SNF. This is Skilled Nursing Facility, and CB is Consolidated Billing. So SNF CB. All right. So what is this basic concept? Well, first, I want to answer the question, how to determine in advance if our charges are going to fall into consolidation or not, since you're not affiliated with the nursing home. And that's what this answers, because this is a bundle. So skilled nursing facility consolidated billing is a form of bundling that makes the skilled nursing facility responsible for most care. The reason we don't say all care is that the skilled nursing facility is only responsible for care within their scope of practice. So what does that mean? Well, that means that first, you as an outside provider must bill the SNF, and the SNF must then pay you for services they're responsible for paying, because remember, there are certain things they can't do. Those things, those items are then listed by procedure code on the CMS website. So again, I will get more into the procedure code list. I do have a couple of questions on it. So we'll get more into that list, where to find it and how to locate it. But the basics of what is consolidated billing, it is a bundled form of payment that says the SNF should be responsible for most things when someone is inpatient in a Part A stay, and we'll get into that too, in a skilled nursing facility. So I gave you a lot of information in a very quick, kind of organized moment, okay? I was asked for the benefits of it. Why was it enacted and where did it come from? I do want to thank you guys for the comment, a little bit of sense of humor someone had on this one. He's like, was this enacted to annoy providers? And the answer is, well, no, but it might. So here's what it was really done. It's really designed so that the SNF who's providing the inpatient care oversees and coordinates the care. That makes sense. So we want the SNF to know what's going on with this patient, not just the patient going out and having random care. Two, it was done to have less patient out of pocket. By applying things into a bundle, the Part A deductible can apply, and then if the SNF has copay days, which would be something we'll talk about in a little bit, It will be their responsibility to add everything together versus having the Part A and B deductible, and then the 20% plus the flat rate copay days plus CMS looked at that and so did Congress, and they said, let's kind of minimize this patient out of pocket. Also, it eliminated duplicate billing. So the skilled nursing facility and the outside entities were both billing Medicare and they were both getting paid for the same service. So when Medicare looked at it, they said, how is this protecting the Medicare trust fund? How is this what's best for the trust fund, the skilled nursing facility to monitor the care and the cost of the patient? And because of that, that's where skilled nursing facility consolidated billing came from. When Medicare looked at this particular benefit, they did give us two types of stays for a skilled nursing facility. These two types of stays are very important to understand because they're part of the basics of whether you should bill the skilled nursing facility, bill Medicare. Okay, so a Part A stay. This is defined when Medicare is covering the inpatient stay in the skilled nursing facility, which means they're covering room and board, nursing care, all of those types of care, including PT, physical therapy, OT, occupational therapy, and SLP, or speech language pathology services. There are certain things that are within that Part A stay and are within the scope of a SNF. What are those certain things? We'll look at those files in just a little while. During this Part A stay, it is based on a benefit period, and a benefit period is the way in which Medicare measures the Part A benefits. Okay, so a skilled nursing facility stay has 100 benefit days, 100, and that is following a 3-day qualifying hospital stay. That would be a technical denial. So no Part A SNF stay can occur if there is not a 3-day qualifying hospital stay. That is one of the caveats that someone did ask about. And what they were asking is, how do you count 3 days? Is it 3 calendar days? And the answer to that is no, it is not 3 calendar days. It is the day of admission, a full day in the hospital, a second full day in the hospital, followed by the day of discharge, because the day of discharge the hospital is not paid for. So it's 3 days and then the day of discharge. So really 4 calendar days. Hopefully that makes sense for a 3-day qualifying stay. Without that qualifying stay, Medicare will not pay for a skilled nursing facility stay. The exception to that is when it is a waiver from a Medicare Advantage plan, but that's on the SNF to tell us that, the skilled nursing facility. So it will not affect the billing portion for anyone else. Okay. Now there is also something called a Part B stay. A Part B stay is simply where a patient remains in a medically necessary skilled nursing facility bed. Like, it's not any change to that, but the 100 days are used or they did not meet a technical requirement. Again, the 3-day qualifying stay, right? So what Medicare will do during that time is look at that patient and for that skilled nursing facility, cover any Part B services that they provide that would otherwise be covered. Now remember, when Medicare says Part A, they're talking about inpatient services. And when Medicare says Part B, they're talking about outpatient or professional services. So what would they cover otherwise? That's what we're looking for. So lots going on with those two types of stays. You want to learn more? Definitely take a look at that. But I want to remind everyone, as I said, a Part A and a Part B stay are all part of a benefit period. Did you guys catch all those benefit, benefit? Benefit, Part A stay, and a Part B stay combined equal a benefit period. Once a benefit period opens, and again, this is the Part A deductible that applies, it opens with a hospital stay. How do we know that? There has to be a 3-day qualifying hospital stay before the SNF stay, therefore it opens with a hospital stay. Now, I was asked under the SNF's payment responsibilities to cover some of these different pieces of information and things that are automatically part of the Part A stay. So let me again define this. During the first 100 days, it is Medicare covered services that are medically necessary and are part of the Medicare benefit package program. So if it's a never covered, non-covered, not covered, however you want to say it, service, it is not the SNF's responsibility, nor is it Medicare's responsibility to pay that. It is the patient's responsibility. Yes, I understand that they are in a Part A stay. However, the SNF can't bill Medicare for it. It's not part of their bill. So you may bill that separately, but you will bill the patient for that. Okay? During a Part A stay, clinical social worker services are part of the facility charge. So therefore, they're part of the SNF's responsibility. Incident 2 services are also part of the SNF's payment. That's because they're for ancillary staff or other lesser people that are providing a different type of professional service that do not meet the standalone criteria, whether they can enroll or whatever. So all Incident 2 services would fall underneath that. Also, as part of the SNF's payment responsibility goes preventive and screening services. Great question came in with this one and said, does that mean that a preventive and screening service is medically necessary? And the answer is no. It is a separate benefit category as defined in the Social Security Act. We know that. It doesn't have to be medically necessary. It has to meet the Medicare coverage criteria for preventive or screening services. However, it has to be billed to the skilled nursing facility if they're in a Part A stay, and that preventive or screening service is only billable to Medicare by the skilled nursing facility. They receive extra money on their bill above their per diem amount, and then they have to reimburse the Part B provider. So hopefully I got enough into that to help you understand, but not too much to overwhelm the person that asked the question. Please let me know in the chat if you need more information with that type of a question. Again, there is some SNF responsibilities during a Part B stay. And those responsibilities are related to physical therapy, occupational therapy, and speech language pathology services. These are these are procedure code driven under a plan of care. That is what the person is in the skilled nursing facility for. Therefore, the skilled nursing facility is responsible for billing them. Do they have to know, i.e., does the skilled nursing facility have to know that they came to someone as an outside provider to be responsible for paying those services? The answer is no. That's not how the Medicare regulations are written. So I wanted to make that hopefully pretty clear to everyone. And again, if you have more questions, I've gone through quite a few different ones there, but if you have more, let us know. Our next slide is given to y'all just basically to explain a little bit about excluded services, which I already did on the Medicare excluded services, but there's another terminology called skilled nursing facility consolidated billing excluded services, or SNF-CB excluded services. So let's hit those hard here and make it very clear as to what gets billed where. First, as I said, a Medicare excluded services. When you think of this, it is never, ever, ever covered by Medicare. It's not part of our payment program. So in most cases, with the exception of preventive, if a service is not medically necessary, it's not covered by Medicare. It's not part of our program. These services are then could also be excluded by the law. Okay? So such as an eye refraction. Well, great. You can argue all you want that it's medically necessary, but the law excludes coverage. Therefore, you must bill the patient. That means that if you're an outside provider, you bill the patient. That means that if you are a skilled nursing facility provider, you must bill the patient for these services as well, should you choose to. So a lot going on with what we call excluded services. I was specifically asked about comfort items, and yes, comfort items are excluded during the SNF consolidated billing portion or the SNF stay. However, they're not necessarily excluded under hospice benefits. I'm not really sure where they were what you needed specifically on that. But under hospice benefits, it is a different benefit. It's a different section of the Social Security Act. So you might need to check a little bit more into that, but I can't really answer whether all comfort items are excluded under hospice because that's not how it works. It's a different it's a different benefit category, a different section. So yes, from consolidated billing, comfort items would be considered excluded. Now, SNF consolidated billing excluded services simply means that CMS has determined the procedure code that you have the documentation for and will bill based on your coder's professional experience that this is what you're going to bill. Therefore, that procedure code is not billable to the SNF. It is billable directly to Medicare. So it is medically necessary. So it's not an excluded service and it's not a not medically necessary service. On the other hand, it is by procedure code excluded from the consolidated billing rules. And we're going to look at those lists in just a little while. Okay? Also, they are not part of the bundle. Now, remember we said consolidated billing is considered a form of bundling. So it's not part of that bundle. The provider performing a SNF consolidated billing excluded service will bill Medicare for that service. It is part of the Medicare benefit category, but it's billed directly to Medicare versus to the skilled nursing facility. And then we want to move on from there. So I'm going to stop because that is the end of the overview. And before we get into the CMS and WPS FAQs and a little bit more on the CMS website, I would like to stop for a minute and just have Ashley verify that I don't have any questions in the chat so far, that I got everything to meet those basic needs.
Hi, Tom. There are no questions in the chat yet.
Thanks, Ashley. All right. What we're going to do at this point is we're going to talk a little bit about some FAQs that are available to you to help you understand, because again, this is a question and answer section, right? So on the CMS website, there are some what are called historic questions and answers on consolidated billing. These really are frequently asked questions. What CMS has done is looked out and gone out and determined, hey, these are the most commonly asked questions that they receive. So whether or not they update them, how that works, that's completely on them. It's not really up to us. So what I'd like to do is leave this slide, but I want to tell you that there is a link right down here on the bottom where you can simply select this link. This will take you there without having to navigate. But one person did ask if I could provide navigation help, and let me do that for you. I think navigation help is an important thing to understand because the CMS website is quite complex along with the WPS website. So we're on cms.gov, and this is where we're going to start with. This is the term Medicare, which is where we're going to find the information we're looking for. When we open Medicare, there's a couple of different things that I want you to be aware of. First, if you go to coding and billing, and the reason I'm showing you this first is we're not actually going to go here, but if you go to coding and billing and you look at the right side of the screen, you'll see that it actually changes. And then there's a section for the National Skilled Nursing Facility Consolidated Billing. We will come here later. This is where those magic files that have the procedure codes and which one should be billed to the SNF or not are located. But let's continue on to these FAQs. Let's continue on. If we go to payments, and underneath payment, we're trying to figure out, what sounds like a good option here? I tell everyone when you're looking at this, you go all fee-for-service providers right here. You're going to see a bunch of different stuff over here, right? If we scroll down, you'll see a lot of general information. What we're looking for is a prospective payment system, which is way down here on the bottom. You can see it on the left side of my columns, but it's way down here. It's called Skilled Nursing Facility Prospective Payment System. And that's how they're actually paid. So let's go ahead and select that. And then you can learn all about the case mix and how about how the payment. Now, we're not going to focus on that. What we're going to do is just scroll down again to the bottom. And I'm trying not to scroll too fast to lose anybody. But and look at the downloads. You can see we have a couple of different downloads. And then what are we looking for down here? Skilled Nursing Facility Center, pricers, all of those types of things. So there's lots of different information. If we look at the consolidated billing information over here, now again, this is where we're going next, and this is on the left corner. We're looking at the SNF PPS and we're looking at consolidated billing. And again, scroll down to the downloads. Again, I'm trying not to go too fast so that I don't lose anybody. This is a lot of the information that I just gave you. So it kind of talks about all of that stuff. Here's the best practices, which is where you can find sample agreements, but here's the historic question and answer section. And here are those FAQs. What is consolidated billing? It actually talks about the Social Security Act section that becomes effective and why it's important to understand. Now, this is important for people that are trying to figure out, hey, a SNF owes me money and they're not paying for me. What do I do? This is what you want to look at. This is the section of the law that you need to look at. And you might need to refer back to a legal counsel. We can't help you with that. It's an agreement between you and the skilled nursing facility, or a billing issue between you and the skilled nursing facility, not between your Medicare administrative contractor. Here's where we talked about, hey, what caused it? And remember, I did talk about these three things. And then it talks about what's excluded. And this is great, but we're like, oh my. It gives me a lot of sections of the Social Security Act. It doesn't give me direct information about procedure codes. So this is nice, but does it really help you? And I'm going to say it does. It gives you a lot of information. Here's what I would like you to do. If you really want to know what's excluded, and we talked about this website briefly as I mentioned it, you can actually come down to the related links and go to the Skilled Nursing Facility Consolidated Billing. Okay, does this look familiar? Some of you it might, and it's very comprehensive. So the CMS FAQs is sending you to this page to find out what is excluded. Now on this page, there are two different lists you have to be aware of, but you are definitely welcome to read through all of this type of information to start with. Okay, there is the Part B list and the Part A list. These are updated annually. If there's an update that needs to occur between the annual updates, and you can look at the Part A or the B list, it will be listed on the slide, or on the page. I'm sorry, it's not a slide. So you'll be able to look through and read all of that information. Now I did open the Part B files up on the top, so let's just scroll down briefly. There are 4 files. Okay. Part A, professional services never ever billable to the SNF, skilled nursing facility. So if these are professional services, why aren't they billed to a facility? Because they're exactly by definition that, a professional service. Okay. Then you've got the Part A stay file, and you're like, wait, what's the difference? They both say physician service and physician, and you're like, wait, what? If you want to look at the second file, and we'll show you again how it correlates, but this is for services that have a professional and technical component. The technical component, or TC portion, is billable to the skilled nursing facility. The professional component, or modifier 26 portion, is directly billable to Medicare. And yes, you do need to make sure you split that and bill those modifiers accordingly. Then you have the ambulance stay. One thing I want to point out, when you look at the ambulance stay, it will give you the ambulance procedure codes that can be billed directly to Medicare. These are your base rate and mileage codes. However, that doesn't mean you don't have to apply bundling first. Remember, inpatient bundling overrules outpatient billing. So we'll talk more about that in just a second, because we did start with the Part B. We'll get down to the Part A MAC updates. And last, remember I said PT, OT, SLP services are always billed to the SNF as long as they're in a medically necessary stay. This is the file that shows those procedure codes. But that doesn't mean that you don't get to look at this great Part A file, and this one's a little different. So this one is one Excel file, but it uses major categories, and each major category has a caveat. So while I can explain it, let me just open this document first. The PDF file down here simply explains the Excel file here, so it'll tell you what's within each major category. So a couple people have asked us about some of these major categories. The first one is major category 1, and it says exclusion of service beyond the scope of a SNF. Great. Make sure you read sentence number 1. Okay. Now there is one portion of this that is a little weird, and it's major category 1F. And the reason it's a little weird or a little different is that it's actually an inclusion list. Inclusion list. These are the surgeries that a skilled nursing facility can do, and they would be included if they were performed in a hospital or critical access hospital. Did you guys catch that? Hospital or critical access hospital. So if somebody asked me about a ambulatory surgery center, you do not meet the surgical inclusion category list. Therefore, okay, you don't meet the criteria for this. Your services are excluded because surgical services are always an inclusion. So hopefully that makes sense to everyone when we talk about that. Otherwise, anything listed here would be excluded or outside the skilled nursing facility, but you always have to make sure you follow the caveats up here, in particular for major category 1, the skilled nursing facility. I was asked specifically about about ambulance trips. I'll get more into that because ambulance trips become a lot harder to understand because they have to be related to certain services and different things like that. So we'll talk more about that. Here's some information on additional excluded services, and here's what it applies to. And again, you can look at some of the different pieces of information for major category 2. Here's where major category 3 is explained, and again, chemo, radiology, all of those. Major category 4, again, these are those preventive services that the skilled nursing facility does receive extra money for. So does the swing bed. However, that means that you must bill them for it. So while it's not included in their per diem rate, their flat fee they get a day, it is still only billable by them. So these are the codes that go with that. And then, of course, we've got the revenue codes that go with the physical, occupational, and speech language pathology information. So there's a lot of different pieces of information that go with this, and I wanted to show those to you based on that FAQ because the FAQs reference you back to this list a lot without actually giving you a lot of information, so they want to reference you back to it. Again, if you want more information on the list, we'll talk about that as we get more and further down. On our website, which is going to be your next slide, you'll talk about slide 11. WPS does offer a couple of FAQs for you as well. They're going to be in the tools area of our website, and our website's wpsgha.com. Select tools, all tools. Pick your jurisdiction for claims processing and the way in which you submit, or line of business as CMS likes to call it. So Iowa, Kansas, Missouri, Nebraska, and our national contract, which is UB04 or 837I line of business, you are J5. If you're in Iowa, Kansas, Missouri, Nebraska, and you submit a 1500 or 837P, you are J5B. If you're in Indiana or Michigan and you submit on a UB04 or 837I, then you're J8 Part A. And if you submitted a 1500 or an 837P and you're in Indiana or Michigan, then you're going to select J8 Part B. Remember, this is not about a service category, it's about a CMS line of business. And let's just really quickly pick J5A because it's in that upper left corner, so therefore that's what we're going to do. Accept the CPT agreement and then move down. And what you're looking for is all FAQs right here. Now I do recommend this. You can go to section by section and look for FAQs. The reason that I like all FAQs, I don't want to do that. I just want to be able to come in, go, oh, yep, I want to enter a filter and I'm going to say skilled nursing facility, and then I want to see the FAQs appear, and then I want to open an FAQ. This is the one about the 3-day qualifying or 3-day requirement. I want to, point this out. I also want to point out the rest of the sentence. The time spent in the emergency room or in an outpatient observation does not count. Why? These are considered outpatient services. They do not meet the criteria for the 3-day qualifying hospital stay. So you want to make sure you're aware of that, which is why I actually brought you to this list so that you could actually see that. If you forget where I navigated to on the CMS website and you want a quick link, drop down here and just go, oh, okay, I can go to Consolidated Billing list. Great. There's one other area that you may find helpful, and that's going to be in the Training Center, right here on the top. So we went to Tools first, now we're just going to move to the Training Center. And inside the Training Center, I want you to watch this column. Okay, and that's my right column in the body, and I'm going to scroll down. And the third item is the Specialty Services Training and Resources. If we open that up and we scroll down, there is a training sheet for Skilled Nursing Facility Consolidated Billing, or SNF-CB. When we open that, it's all links, all kinds of links to help you out. This is just a really fast, nice resource if you're looking for what WPS has versus what like what CMS has, and where do you go to get what you need and what do you want to do the best possible. This is a great resource to provide that to you. Okay? If there is something that you use and you don't see this, please feel free to email us. Give us the the name of the page and the URL right here on the top, and just tell us, hey, I use this all the time. Can you add this, or is this something you would consider? Email us at, again, and I'll give you the email. You can write it down. It's in the chat. Ashley's put it in there. She might want to stick it back in there, but you're going to put wps.gha.education@wpsic.com. In the subject line, put SNF CB resource. That's what we're talking about here. And then indicate, hey, on this page, could you add a link to? And we can do that for you. We want to make it as easy for you as possible to find what you're looking for regarding this complex topic. Okay. But you can see here's exactly, we went out, we looked at these, but here is that consolidated billing question and answer document. Here is a course written by CMS, some billing references, a variety of different things you might need, along with a quick reference from us and some other information available for you. So those are the two types of areas, or the three actual areas you might want to go to get a little bit of additional help. What I'm going to do now is, if you're in the slide deck with me, you're going to notice that I did talk about these questions. I did talk about these questions. I moved through this training section, and now we're on the registration questions. So you can use the bottom part of the slide if you printed it that way. Take notes if you have that. I will go through the different registration questions that I have not already addressed, because I did go through quite a lot of them. First, we did address this one briefly, but I'm going to summarize it again. How to determine SNF consolidated billing. Well, first, you have to use that CMS list on their website. But you also need to determine whether or not Medicare is covering the SNF stay. Remember, we talked about that. Is it a Part A stay or a Part B stay? Right? It's not that it's not medically necessary. That's not what we're saying. Also, you have to determine whether or not the service or whether or not the patient is in a medically necessary state. What does that mean? How many of you know a patient that lives at a skilled nursing facility or at a nursing facility? Well, if that's their residence, then they're in domiciliary care, residential care. This is not going to be subject to consolidated billing. They're not even in a skilled nursing facility consolidated billing bed at that moment, or a skilled bed. Now they might be, but they're not in a medically necessary state. It just depends on how that facility is set up. What would be considered part of the SNF for ambulance billing? Again, this is the one that is probably the hardest to answer. Please remember that when you look at ambulance billing, as I said, that file indicates that it has to be related to other services. Let me drop back there for 1 second and tell you that file is on the CMS website, and it is the major category general explanation. And you need to make sure, get back up here, that you are in major category 1, that you're following all the criteria, and that you scroll down. What we're looking for is ambulance services associated with A through E and G. Remember, F was the included, so of course it doesn't, look for that. If it's any of those, then those are excluded from consolidated billing. Major category 2A provided in the renal dialysis facility. So it says, hey, end-stage renal disease beneficiary and whether or not that service is. These ambulance trips, if they are included, so they're not associated, they don't meet the criteria to meet any of the other ones by procedure code at the destination, would then be included. So if we go back up here, let's just say it's an MRI and you get the MRI code from the destination. Now you have to determine whether that MRI is included. Okay, so does it start right here at the beginning? Is it in a hospital or critical access hospital? Does it meet the MRI code list? If it's on the code list and it was done at a critical access hospital, it would be excluded. Therefore, the ambulance trip associated would be excluded. But it's an MRI, even though it's on this list, but it was done at a freestanding diagnostic center, then it's included because it doesn't meet this portion of the statement. That's how the ambulance trip works. But please remember that we always hear from an ambulance provider, well, the SNF says they can't bill revenue code. Yes, I understand they can't bill the revenue code for ambulance. I get it. They're in an inpatient stay. Why are we taking them somewhere? The answer is, in our example for an MRI, they must incorporate that cost into the MRI. So that's why I said it's a bit more complex and there's a lot of things that go back and forth with it. So hopefully, as you got that, that was a really high level. There is on our YouTube channel a playlist that you can take a look at, and it's going to have a lot more information out there, things like that. Okay. Uh, can a SNF bill Part A claims while the resident is on palliative care? Now, palliative care is different than hospice care, and I want to make that clear. Hospice care is a completely different, separate. They're not supposed to be receiving um, medical care for the hospice diagnosis. It does not mean that they could not get medical care at all. Two different things. During hospice care, if it's related to the hospice diagnosis, probably not. Palliative care, though, they could receive. Okay, so yes, you can bill palliative care. So if a beneficiary is on a SNF Part A service, but the family wants palliative care, does the SNF have to provide the NOM-NOC to be signed by the family? And the answer is no. Part A coverage is not ending. Yes, they're getting palliative care, but they're still not ending the Part A coverage. Now, if you happen to switch to palliative care and put the word hospice care in there, it's a different thing, and yes, you would. Okay, so hopefully that makes sense to everybody. For those that asked that question, for those of you that are like, whoa, that was too much information, I apologize. Clarification on dental service. Clarification on if the SNF is responsible for payment of dental care while a resident is on Medicare Part A. Medicare does not cover any routine dental care, therefore, no. Now, if a dental service has to be provided as it relates to something else, such as a surgical, then you have to go back and look at whether or not the surgical falls into this outpatient surgery list that the skilled nursing facility can safely do. Then the dental care may be billable to them. If not, because it's part of the surgery, then it's going to be considered separately billable to Medicare, and you want to look at the Medicare dental exceptions. Okay? But routine dental care not covered. Who do you bill for anything not ever covered by Medicare? You would bill the patient for that. Next question is, can you report a SNF to Medicare when the SNF refuses to pay? CMS will take the report. We at the MAC, we can't do anything, so reporting to us does nothing for you. You need to go to a minimum of the CMS regional office. How they handle that, we don't know. Here's the guidance that we've been given to give to you. This is a legal disagreement between you as an outside provider and the skilled nursing facility who's responsible to pay. We would encourage you to pursue the skilled nursing facility like any other debt that is owed to you from any other payer. You must contact your legal representative for help on how to do that. There you go. We can't really help you, especially at the MAC level. We can't really do anything with it. So I was asked to, before I leave this is my last question. So again, if you have anything and you want it in chat, oops, sorry. Let's go ahead and make sure that we get that out there. I was asked to show you the Part A files. So again, right now I'm in the Part A Mac update. We just went through this general list. The file I think you were talking about is going to be underneath this 2026 Skilled Nursing Facility Update file. Now I will tell you, I save the file out here on my web. It is a zipped file or a compressed file or whatever you want to say. Basically, it's so big that CMS does this on purpose. What they do with that is to put it into a software that actually compresses it to store it on the website to make it smaller. So when we open it up in my zip software, this is what it looks like. It's right here. Okay, you can read either one, but I like the second one. Just Tom's version. When you open it up, well, I have that open and it's still not opening very fast. So when you open it up, you will see how it's laid out and it will give you the major categories. It will give you the procedure codes, and those are the important things. Okay, here we go. So you can see here's the procedure codes. Here's a short description and the major categories. Remember, if you don't know what this major category is and what the caveats are that go with each major category, that's where you need to go back to the CMS website and read the general explanations. Okay, but you can look up any procedure code on here and you can find just about anything you want. A couple of major categories I do want to point out with this that would be in the general explanation. Someone asked a question on emergency room services. There is no list of emergency room services. So if you're looking at major category 1 and then you go to G, this is where you get your emergency room services, okay? What happens is if the emergency room or if the hospital does not bill with a 045X revenue code, it's right here in this line right here, the system does not register that an emergency room service occurred. Right? That's what the system needs. It has to be there. Now, when we look at that, we look for that service. If the hospital doesn't bill it correctly, or if it's not received yet, that's the more likely situation. We can actually deny services saying, no, this is part of consolidated billing because the 045X revenue code, this revenue code coming in is what shuts off the consolidated billing edits for a period of time. And that period of time is when they're in the emergency room, when they're in the hospital, and when they're getting all of this, okay? If it is a post-ER service, and you can see Medicare is very specific here that you do need to append modifier ET. So if you don't do these billing type things or the facility doesn't, then you will not be paid. And I think that's the issue that's going on. I'm not sure which one because I don't have that information from the person, but the emergency room has to be first billed to us before we can stop the association. And let me explain what that means. Emergency rooms do not bill on a daily basis. They're considered part of a facility and are usually billed on a monthly basis. So that means that you, as someone who provides a service, may bill, and we may know that that person's in a skilled nursing facility and you get a rejection. Well, that's simply because for that month, the emergency room service hasn't come in yet. We haven't had that shut off yet by having this revenue code 045X. So hopefully that makes sense to the person that asked the question. All right, so that's a little bit about those registration questions, and I did get through all of them. I would like to ask Ashley at this point, do we have any questions?
Tom, there are no questions in the chat.
Awesome. Well, let me give you a little bit here. If you do think of a question for the next 7 days, if you do think of any question, feel free to drop us an email. Ashley's put this a couple of different times, but I'm just going to read it off again. The email is wps.gha.education@wpsic. Put that into the chat. or I'm sorry, put that into your email with the subject line SNF CB, Consolidated Billing, question and answer. If you don't put question and answer, you just put SNF CB, that will work too. What we want to do is make sure it comes to me. We'll take those for 7 days, okay? Our goal is to put this question and answer session as a recorded information on the YouTube channel as well. So when you look at the playlist, you want to make sure. One question I did skip, and I apologize for this because I just realized it. So before I move on, I want to address it. I'm going to go to our website first because the person is asking about where they can locate information on our website about the actual SNF stay. So I always recommend that you use this login section right here. The question comes in and it's about the portal, which is right here. The portal user manual requires you to log in. The portal user manual will explain all of the screens in the portal. So once you log in, you have to know where to go. I'm going to tell you it's in the eligibility section. So we're just going to scroll down and you'll see headers in the bottom. Scroll down and then you'll find out that you have practice, and then you'll find out you have patient and you have eligibility. We're going to do an eligibility check. The portal user manual will walk you through this piece of information. So if you're looking at this, it says, what is the source for this? It's the HIPAA eligibility transaction 270-271, which does relate to the information from the common working file or the storage system for Medicare. It does store both eligibility, claims processing, Medicare secondary payer information, or who's primary payer to Medicare. There's so much in the common working file. This transaction accesses that information. So as we scroll through, it'll tell you how to do it. And again, just kind of bear with me as I scroll down. As I scroll through, you're going to look at the eligibility and it's going to give you your basic patient information, which you did enter up here. Okay. Now it does require you to have a start and end date. It can be the same date, but that's important when we look at this information. Okay. Because under eligibility, you have a summary and this key information, if you read through this summary, and I'm just going to scroll down to the summary, is the benefit summary. So people are looking at this portion, which is skilled nursing facility, and they're saying, wait, I don't understand why this isn't changing. Well, that's because it's their benefit summary for the year. You're not looking at the correct information. What I would recommend is move on to the Part A deductible tab, and you can see that highlighted here. If they happen to have a skilled nursing facility stay, that's where you'll find the earliest and latest billing dates and remaining deductible. Someone said, does the latest billing date always fill in? Well, no, because it's still open. Now, what it will do is give you a date of an interim bill, because remember they bill in 30-day increments, so it'll give you the latest billing date there. Copay days remaining is important because how it works with the benefit package is you get, after party deductible is met for the benefit period, 20 full days and 80 copay days. So 20 days where we pay in full and then 80 copay days. So this is just talking about the copay days. Okay. And then here's the billing NPI, which is the actual facility, which you'll have to look up. It's a skilled nursing facility. So I'm sorry that I skipped your question. I didn't mean to. I didn't mean to ignore it or anything like that. I do want to check back with Ashley one more time. Did anything come in while I was explaining that section and where to go?
Nope, nothing in the chat.
Okay, let's move on then. A couple of reminders, slides put in here. These are not in your slide deck. These are just reminders. One, skilled nursing facility consolidated billing does cause overpayments, and they are caused from unsolicited responses. In other words, the skilled nursing facility sends in a claim, and for those of you that have filed your claims of Medicare already, if it is subject to consolidated billing, our system, not us, but our system sends you a letter, and that is a way in which you can get us money back. Okay, so it is called an overpayment, and what you can do is send us the money back. The preferred way is on our website in the Secured Net Access portal, which we just looked at the user manual. I do recommend that. You can do a refund or you can ask us to take money back. So if you discover that something's going on with a skilled nursing facility and it's just not billed yet, you could actually ask us to take money back. So you're looking for the overpayment claim adjustment reason. Or you can send us money back electronically in the refunds section. If not, feel free to grab one of our paper areas. And the reason that we say areas is because it's based on that CMS defined line of business, and you want to make sure you're in the right one. And then you go to the overpayment refund notification form and you grab that form. When you do that, you want to make sure that there are fields across the top, and there are three of them. And I guess I'll show you real quick. It looks like we have a couple of minutes here. And if these are not filled out correctly, you will struggle a little bit. So just going back, and we're going to leave the eligibility area here. If you scroll down again, you're going to scroll all the way to the bottom, and this is the preferred method. When you get into finance, this is where you'll find the refunds area. But I don't want you to look here if you're requesting an overpayment. You see this claims adjustment, overpayment claim adjustment. It's under transactions and claims. This is where you request. This is where you send us money. Now, if you don't want to do that, you are welcome to complete the form. Again, go to Tools, All Tools, open your forms. You can search for overpayment or filter for it, whatever you want to do. I'm just going to open it up here. And here you'll get to read all about it. Notice it is one form. It's two features, but one form. So here we go. It explains it. It talks about the form, talks about refunds, all of that. You don't have to send a refund with this form, but you can. These top three fields are problematic because people are doing this as if it is a benefit category, not a CMS line of business. Remember, just like our website, Part A is a UB04 or 837I transaction. Part B is a 1500 or 837P. Please make sure that you select the right contract and also the correct state. All of this is needed to make sure we process all of this time. If you miss any of this, you could cause other problems. So a little bit about that overpayment area. Want to remind everybody that there was a change on June 1st, and that is that we will not be issuing paper decisions for Part A redeterminations. In other words, Part A Level 1 appeals. That changes that will only issue the decision in SNAP, and you are able to get that information. It's a letter in SNAP. The screen will help you a little bit through it. So it says close. It'll tell you all of that. You can view your decision letters and all of that in the Secure Net Access Portal or SNAP. All right. I gave you a lot of information. What I'm going to have happen right now is for Ashley to put a link down in that chat. That link goes to the survey. It's the same link that we're going to give you an opportunity to go to when we close out of the webinar. What are we doing with this survey? We're looking at how well we did with the webinar, how well we do overall. There's 5 basic questions, and then a way that you can provide additional information if you choose to, but that's up to you. We really do ask that you take a couple of minutes, complete the survey. Again, there's 5 basic questions. Complete it honestly. Tell us what's going on. I want to remind everyone that even if you're taking this as an encore presentation, we still want your survey feedback. It's going to look like the lower picture. You'll see a little online survey with a hand and a finger pointing to the top 5. Please take the survey. Again, you can take it more than once based on whether you've done it live and online. You want to take one for each one. Okay. So hopefully we have that there for you. All right, that brings us to the end. I want to remind you that in a few minutes, you're going to get an email. The email comes from our software, our webinar software. Please feel free to keep that email, open it. Look for the certificate because the certificate's attached and it has contact hours. Contact hours translate to CEUs. We don't issue CEUs, governing bodies do that. So please make sure you take the time to open it. Also, it's going to have a link to the survey and it's going to tell you how to send a follow-up, but I've already explained it. I'll just talk about it real briefly here. If you have questions for the next 7 days, feel free to send those in. Again, I had Ashley put that link in the chat, and I had Ashley put the email address in the chat. The email address is wps.gha.education@wpsic. Please make sure it says SNF, CB. You could put Q&A. That would be a little bit helpful. Webinar, something like that, in the subject line just to get it to me. All right, last check. Ashley, any questions?
No questions in the chat.
All right, so on behalf of myself, Ashley, all of Provider Outreach and Education, we want to thank you for your participation today. We do look forward to your survey comments, and we hope that you'll join us again for future events. You may now disconnect. Thanks, everyone.